We felt very strongly about adding a sixth P for multiple different reasons. I think for me, one of the biggest driving factors was that sex should be pleasurable.
If you take a random sample of folks walking around the street and ask them, why do you have sex? Most of them would say, because it feels good, or it brings me pleasure.
If you don't ask about sexual pleasure, I think you can miss quite a bit. You can miss emotional problems and you can miss physical problems that you might be able to correct.
I think as a society, unfortunately, we still have so much stigma and shame associated around sex that we're not comfortable as a society, and unfortunately as some providers, asking about pleasure.
Pleasure meaning, does it physically feel good in the context of, are you experiencing pain or discomfort when having it? Is it consensual? Do you feel safe?
We have a case in which we have dilators and vibrators. They're right out in the open. They're bright pink. You can't miss them. And this allows patients to say, this is normal. I had an 85-year-old patient whose husband died. I've known her for a long time, and she said, Dr. Jerome, I sometimes have some sexual urges. Now, an 85-year-old telling me that is, pretty amazing. And I said, well, we've got some vibrators out there. How about if we give you one of those? And she said, I was raised Catholic. And, you're not supposed to really do that. And I said, well, I was raised Catholic too. And I think that, from the doctor's point of view, this is certainly fine. And she went home with a vibrator and she was quite happy.
We receive a lot of training, but we don't receive a lot of training about this and how to convey these concerns to our patients. The CDC has some really great tools. The National Coalition for Sexual Health has some amazing tools. Bedsider has some great tools.
We know that people that have satisfying sex lives and are happy with their sex lives do better mentally, do better with stress eradication or dealing with stress. It affects the whole holistic person, not just their genitals.